Hello, it's Dr. Rachel Brown, and I'm the Medical Director for Prevention and Wellness with Employer Health Services at Prisma Health. Note the new name, we're now Employer Health Services, and this is your monthly health and wellness update. I am going to share with you today a little bit of information about more than just COVID. Yay! Unfortunately, we're going to be talking about all of the other respiratory illnesses. So let's dive right in and talk about what you can expect this fall and maybe how you can help with prevention and mitigation of respiratory illness outbreak in your workforce. Okay, so the first thing we need to know is that respiratory season has already started. You all may have had your own personal experience with this already. COVID is certainly still a culprit, and we still need to isolate when someone has COVID. We still need to talk about what to do when someone's exposed. But our bigger players during respiratory season this fall are RSV, or respiratory syncytial virus, and flu. We are seeing much higher rates and anticipating even higher rates of RSV and flu. And what's interesting about RSV is that typically we see this in children. Certainly can happen in adults, but we see it more in children each fall. This season, though, we're seeing this in a lot of adults. So let's talk a little bit about the differences between COVID, flu, the common cold, and RSV, all of which we're going to see, and we are seeing. A couple of things I want to point out from this very busy slide that are important, and that is around symptoms. And so this can help you and your employees to understand which of these might they be suffering from. Now, honestly, in this day and age, I really encourage people to be seen by a provider, evaluated by someone, possibly tested for all of these things, because there is so much overlap. However, there are some hallmarks within each of these respiratory illnesses that can help us to determine which one of them may be happening if someone is sick. One of the hallmarks with flu is that really, really run down feeling, fevers, and body aches, or what we call myalgias, where you just feel like your muscles are so sore. That's very typical for flu. Often folks can have a sore throat as well. You can see here, beside COVID, really all bets are off, right? Every symptom you can possibly think of. People with COVID can feel more sick than they do with flu or colds or RSV. We also know that some people have COVID and don't even know they have COVID. But someone who's symptomatic from COVID can have GI symptoms as well, which is not typical for the other respiratory symptoms, or excuse me, diseases. And of course, that loss of smell and taste is kind of a hallmark for COVID. Now, RSV is going to mean lots and lots and lots of coughing, congestion, and runny nose. We see a lot of secretion in kids that have this, and of course in the adults as well. So trouble breathing, wheezing, that can also be RSV. So already right off the bat, you can see there's a lot of overlap here. We use our clinical suspicion, histories of exposure, and some of these presentations of symptoms to try to help us to understand what disease each of our patients has, but that testing can be definitive. So COVID testing, RSV testing, flu testing is important here. Now, what's important for you to know as an employer is over here, level of infectivity. And so it can get a little tricky, right? Because with flu and, RSV in particular, a lot of times someone can be contagious before they even start to have symptoms, right? So they may be walking around not realizing they have the flu and be spreading it. With RSV, symptoms can last even up to a week and a half, 2 weeks, and that cough can be persistent even beyond the time that someone is contagious. So as an employer, when you're thinking about, well, when do I feel comfortable having one of my employees come back to work after they've had one of these infections, it can get really tricky, right? We may be exposing folks before we even know we're sick. When do we bring people back? I will tell you a rule of thumb is that 24 to 48 hours after fever has resolved, if people are feeling better, we generally have them come back to work for common colds, RSV, and for flu, not for COVID. But remember, people still may be contagious. So you can see here that people with colds really are only contagious in that first 2 to 3 days. The folks who have flu are contagious really while they have fever, but kind of peaks around day 3. People who have COVID, we know can be contagious for a very long time. So the recommendations are still, if someone has COVID, that they isolate, they do not come to work, they do not leave their homes for 5 days since the onset of symptoms or since the onset of a positive test. And then if they're feeling better and can come out of isolation after that 5 days, they should still wear a mask for an additional 5 days. RSV is a little trickier. There are studies that show RSV can remain contagious anywhere from day 3 of the illness through day 8. But we're not having them isolate, correct? So we're going to talk about what you can do as an employer. Now, if you save this video presentation and you take a closer look at this slide, you'll see this slide really is for children. But the symptoms, the duration of illness, the duration of infectivity is the same for adults as well. All right, so let's talk about what you can do personally and how you can promote among your workforce prevention of infection. It's nothing new. It's exactly the same thing that we did in earnest for COVID and probably should have been doing in earnest before that for flu and for RSV. Hand washing, number one mechanism for mitigating catching one of these respiratory viruses. Hand sanitizing is also okay if your hands aren't visibly dirty. Vaccines. Now, we only have a vaccine for COVID and for flu. They are very effective at keeping folks out of the hospital and having serious disease. People can still have COVID and flu when they're vaccinated. They're not 100% protected, but their disease, if they do get it, tends to be much milder. So this can be extremely important for you or for members of your workforce who have chronic disease or who are at high risk for complications of flu and of COVID. And then generally taking care of ourselves. The better our nutrition is, the better we're hydrated and we keep drinking lots and lots of fluids even before we get sick, and the more well rested we are, the better we're going to be at fighting off infection. Now, you may feel like as an employer, you don't have much control over this, but there are some things that you can do to help to protect your workforce from getting respiratory diseases. First of all, make sure there's plenty of soap dispensers, paper towels, hand sanitizers all over the place in your workforce. Encourage your workforce to get vaccinated, whether that means having us come back out and help you re-educate folks around the COVID and the flu vaccine, or we can have a flu and COVID vaccine clinic for you and vaccinate folks in your workforce who may not be vaccinated yet. Remember that flu is right now a yearly vaccine. We will likely see that happen with COVID. So be thinking about how we can help you host those vaccine clinics. Helping with healthy lifestyles is a cultural message that you can send out to your workplace, ensuring that if you have vending machines or food services on your site, that they allow for healthy opportunities to eat healthy foods, making sure that folks who maybe work in a situation where they can't always have their water bottle near them, maybe they're on the line, that they have frequent breaks to go and hydrate and make sure they're drinking healthy fluids. And really looking at extended work time. So we know we got workaholics out there. Some of you may be those folks. And really looking at what that means. Double shifts, staying late, overtime, in terms of impacting someone's ability to get rest. A little extra wellness tip that I'll throw in for free here is that naps actually make your workforce 80% more productive after that nap than someone who hasn't taken a little bit of a snooze. And that can happen even after 10 minutes. So while that may seem a horrible thing to allow our employees to sleep on the job, you might consider options where folks can take a break for 10 minutes, maybe close their eyes. They'll end up being more productive for you than the folks who haven't taken a nap. All of these things are great for prevention, but let's face it, we're going to have employees and you yourself may end up sick. So what do you do once you have employees getting sick? You've probably noticed if you have small children, massive numbers of absences in our schools right now. Schools are petri dishes for all of these respiratory diseases, and we're seeing class sizes plummet because there are tons of kiddos home sick with these respiratory illnesses. This may happen among your workforce as well. So what can we do? The most important thing is to really encourage employees to stay home if they're sick and to set up the environment in your workplace to drive that home and for folks to feel safe to do that from your perspective, right? From the employer's perspective. We understand that there will still be employees who need to work, who have situations at home that keep them from feeling comfortable missing work. And so friendly leave policies are important here. But truly, in order to mitigate any outbreaks of any of these respiratory illnesses in your workplace, we really have to make it safe for folks to say, I don't feel well, and stay home and not feel that there are any financial or other consequences from that. The next thing is, let's reiterate here, if someone is COVID positive, they still absolutely need to isolate for 5 days. I think we've kind of gotten comfortable with COVID. We're now calling it an endemic instead of a pandemic, but it doesn't mean that it doesn't have severe consequences for folks and will put people in the hospital and cause deaths. So we really need to make sure we are protecting our vulnerable population from COVID. So those folks who have it do need to stay home for 5 days. If they're feeling better enough and don't have fever after that 5 days, then they still need to wear a mask. Consider encouraging anyone who's gone home for a respiratory illness, whether that's COVID, RSV, flu, or the common cold, asking those folks to wear a mask for another 5 to 7 days after they return to work too. And even your employees who report an exposure. Maybe grandma has the flu and they visited last weekend. Have them wear a mask for a week, just in case, and watch for symptoms. We've all gotten more used to mask wearing. I understand a lot of people don't like to wear masks, and it can be uncomfortable for some, but this is a great way to stop the spread. So if you have supervisors who know they have employees who were homesick, encourage them to encourage their employee to wear a mask for a few days after they come back, just to assure they're no longer contagious, especially with RSV and COVID, right? Because they're contagious and infectivity period is much longer. So as an employer, make sure you have plenty of masks around too, so that you can encourage those employees to wear them. And then finally, helping your workforce to have easy access to care is going to be an important step. One, to be evaluated so that they have a better sense of whether this is a cold, allergies versus something more significant like flu, COVID, or RSV. Also, so that they have access to easy testing. We certainly know that you can walk into any drugstore these days and get a home test, okay? So we want to make sure people can go ahead and test for COVID, but we don't have on the market flu and RSV tests yet. So having access to that healthcare is important to discriminate between these respiratory viruses that are all peaking in these next few months. Urgent cares are important, but we kind of want to keep our folks out of urgent care as an employer because there's a higher cost. So let's focus on getting people into primary care or on-site clinics if you happen to have one. We certainly do those. And so if you're interested in setting up an on-site clinic at your organization, please reach out to us if you don't already have us present. And then we also have telehealth opportunities. That is popping up all over the place. You're probably familiar with that. Your employees may be familiar with that. Certainly can be an effective way to help triage what may be going on with someone with respiratory symptoms. May not get them the test they need, but it can help them understand what they may have and how long they should stay out of work, or maybe even mask. So one up and coming access model for healthcare that we are working on here at Prisma Health and Promise Healthcare, we want to provide direct primary care access to more and more employers across the state. So I just want to take a moment to talk to you a little bit about what that means and pique your interest in direct to employer primary care. So here is the overarching concept. Please don't confuse this with concierge medicine. It's a little bit different. What we're talking about here is a sort of capitated system, a per member per month financial model, but the clinical concept is this. We want to establish a high quality, relationship based, comprehensive primary care resource for your workforce. So we're talking about the full scope of primary care. We're talking about addressing all of the wellness dimensions, all of the care gaps and metrics to make sure that you have a healthy worker, an employee on your workforce in a way that's easiest for you and easiest for them. It's a very high touch system of care with same day appointments, longer appointments time, longer appointment times, a care team that is devoted to your population, unlimited visits with no cost to that employee. But I want you to think bigger when you think about direct to employer primary care, because we not only want to make seeing your individual employees a better experience and a more robust experience and an easier experience, we also want to look at your population as a whole, the workforce as a whole, and talk about what makes the most sense for your workforce, given what you do, given your environment and your culture, to get them to be the happiest and healthiest that they can be. So we're looking at this from, yes, an individual medical care system, but also a population healthcare system. All of this results in a decreased cost for the employer and the employee. So what we're looking at here is managing healthcare in a way that keeps people out of the emergency department and out of urgent care, decreasing specialty referrals and doing as much in-house as possible, really being in tune with the population and the individual. So we're only ordering tests that are appropriate and managing folks in a way because with chronic disease management, early intervention, follow-ups after urgent care visits and ED visits to decrease hospitalizations, all leading to better care, better satisfaction on your part and the patient's part, your employee's part, and decrease cost. So if you're interested in pursuing a direct to employer primary care model, please reach out to us. If you're interested in an on-site clinic, reach out to us. If you're interested in vaccine clinics, please reach out to us. And if you're interested in consultations from me to talk through how do we manage all of the respiratory diseases that are swirling around out there, please reach out to us. If you go to our website, which is listed here, Employer Health Services, again, check out our new name. You're going to see a telephone number there. You can reach out to us and schedule a consultation. If you scroll down, there's also wonderful information about our wellness programming, screening services, on-site healthcare opportunities, and occupational health. All right, that's it for me this month. I'll see you in 2 months. Stay safe, wash your hands, wear a mask when you can, stay healthy. Remember, we're here to care for you so you can care for your workforce.